Armed with vaccines, boosters, and antiviral, President Biden should fare well with COVID, doctors say. I'm Tyrone Bowman. This is Tyrone Bowman Tonight. Let's get right down to it. According to an article in USA Today, and I quote, while President Joe Biden, 79, was diagnosed with COVID-19 Thursday morning, doctors said they should expect him to cope well with the infection, highlighting his overall health treatment and fully vaccinated status. He has a runny nose, an occasional dry cough, and is fatigued, his doctor, Kevin O'Connor, wrote in a letter early Thursday to the White House that was made public. Quote, the president is fully vaccinated and twice boosted, so I anticipate that he will respond favorably, as most maximally protected patients do, O'Connor wrote. Close quote. COVID-19 vaccines have been shown extremely effective at preventing severe disease and death. Though they do not prevent all infections, O'Connor quickly prescribed Paxlovid, an antiviral that is known to reduce the risk of severe disease. Other doctors agreed that the president's vaccination and treatment suggested that he will have a mild disease course. Quote, I would expect him to do well, said Dr. Daniel Griffin, an infectious disease specialist with Pro Healthcare in New York. Vaccines and 2 booster shots would have reduced Biden's risk of severe of COVID-19 by about 90%, Griffin said, and the Paxlovid by another 90%. Older people tend to have more severe COVID-19 than younger patients, and the majority of deaths from the virus over the past 2.5 years have been among those over 75. But Biden is healthy and active and is not known to have any conditions, such as diabetes, that are associated with bad outcomes from the virus. Close quote. Quote, he's really quite fit, said Dr. William Schaffner, an infectious disease specialist at the Vanderbilt University School of Medicine in Nashville, Tennessee. Close quote. Quote, Schaffner said he has known many people of Biden's age who contracted COVID-19 after being vaccinated and boosted and were able to continue working through their illness, though they had to reduce their busy schedule and take naps for a few days. At this point in the pandemic, when it comes to those who end up hospitalized and dying because of COVID-19, it's not a 79-year-old who's healthy, whose weight is in check, who's active and fully vaccinated and boosted, Griffin said. Rather, most of the hospital admissions he sees are among the 20% of New Yorkers who are still unvaccinated. Despite the vaccine's effectiveness, older people may need boosters more than often, said Dr. Ofer Levy, who directs the Precision Vaccines Program at Boston Children's Hospital and sits on a federal panel that reviews vaccines. Biden received a 2-course vaccine and has since gotten 2 booster shots following federal recommendations. The human immune system is weakest when we're very little and when we're old, Levy said, which is why younger children need a lower vaccine dose than other people, and why older adults may need boosters more often than younger people. Quote, the immune system is less powerful as we age, close quote, he said. Quote, even if you're very healthy and active, age is a risk factor for progression and serious disease. Men also fare worse than women with many diseases, including COVID-19, because their immune system is less active, Levy said. Older people may take longer to recover from COVID-19 and can experience different symptoms than younger ones, said Dr. Kenneth Kokajala, you know what? I'm gonna forget that paragraph. Many of us patients arrive with gastrointestinal problems, fatigue, and brain fog instead of typical respiratory symptoms, he said, which can delay their diagnosis. President Biden, we pray and hope that you recover quickly. Continue to keep the faith. Victory is is at hand. I'm Tyrone Bowman. Never surrender. Never